to the first podcast from the Venkat Centre for Aesthetic Health. Today we have Dr. Venkat sir with us, and on this occasion of World Psoriasis Day, he'll be sharing a few insights. So welcome. Sir, so
Thank you.
what is a psoriasis? This is one of the most commonest thing that the patients come to us with. So what is psoriasis, sir? Please tell us.
See, psoriasis is such a common disease which is characterized by whitish scales.
Right, sir.
You can see in this slide here, they have a red background, the skin is reddish in color. On top of it, there are multiple white scales which falls down like a powdery stuff. This occurs on the scalp, body. It is more common on the bony prominences. It can occur anywhere in the body. It can occur in any age. It occurs in both men and women, and it varies in severity. Sometimes it is mild, in some people it is severe, and it waxes and wanes. And it may disappear completely for some time, only to reappear after few years. So all kinds of variations are possible in this. This happens because of a immune dysregulation.
Right,
The
sir.
autoimmune process is happening in the skin.
Yes,
The
sir.
cells are getting deranged, the lymphocytes, that is leading to increased proliferation of the skin cells. And more cells are produced, which comes out like a scale.
Right,
So
sir.
this in brief is what is psoriasis.
Sir, so why do we need to know about this disease, not as doctors, but from a lay person point of view, sir?
That is because number one, it is extremely common. It is one of the commonest skin diseases. Second, because it affects both the body as well as the psyche. It causes a lot of distress to the patient.
Absolutely, sir.
When it occurs, it affects the appearance of the person, makes the patient conscious. And when it comes again and again, they become frustrated. And in some special areas like the palms, when it happens,
Yes, sir.
it can affect the function. Same thing happens when it occurs on the feet. It develops cracks and fissures. They may have difficulty in walking. And when it happens on the scalp, the powdery stuff falls. They don't like it, and it causes severe itching. The other reason for it, why it's so important, is it can also affect other organs of the body, commonly joints.
Right, sir.
Then it affects function. If somebody gets joints swollen here and somebody is a computer person, he can't function. Then third reason is that now it has been found that psoriasis over a long period of time, particularly if they are obese, if they have associated diseases like blood pressure, diabetes, etc., they form part of what is called metabolic syndrome.
Right,
This
sir.
metabolic syndrome is extremely prevalent, particularly in India now. 20-25% of the population have metabolic syndrome. So, thus, psoriasis is a risk factor for developing metabolic syndrome, which means somebody with psoriasis is more likely to get diabetes, more likely to get heart disease, hypertension, such issues. For all these reasons, psoriasis needs to be understood, it needs to be treated and diagnosed, and needs to be treated properly over a long period of time.
So you said that sometimes it comes back, then remains quiescent for some time. Again, it can occur. So does it not get cured, sir?
See, this is a common question people ask. Can you cure it? If the cure means that we give some treatment, it disappears, it will never come back again, that is not possible. We don't have such a treatment till now.
Okay, sir.
But if the cure means that it will disappear and then we can maintain it with treatment, that is possible. That is what is the case in most diseases. Diabetes, we treat it,
Yes, sir.
and then the patient maintains with treatment. That is what is also needed in psoriasis. This is something which has to be understood. Currently, there are drugs available which are extremely safe, which can be taken for a long time. So, safety of drugs is not the issue. Secondly, this is what is called a multifactorial disease, which
Okay.
means there are factors in the body causing it, there are factors in the mind causing it, and there are factors in the environment which are causing it. For example, in winter, psoriasis becomes more.
Yes, sir.
In cold weather,
Yes, sir.
when there is an injury, psoriasis can happen. Stress can increase psoriasis.
So
Now,
true.
all these things cannot be controlled by drugs. That is controlled by lifestyle. So, apart from taking treatments with drugs, it is also important that the patient has a stress-free life, proper exercise, and then free from other types of stress. These are also equally important.
So stress is there every day with us. We just cannot remove it. So how can we control it in relation with psoriasis, sir?
See, when we say stress, we mean two things. One is acute stress, which happens because of certain sudden episode. It may be death in a family, a divorce,
True, sir.
or some serious illness for a person,
Yes, sir.
loss of a job. These kind of stresses, they come, there is nothing much you can do about it, and then after some times it stresses. The other type of stress is a chronic stress, which happens over a period of time, and that is extremely important now. For that, a healthy lifestyle, uh, some types of non-pharmacological options such as meditation, yoga, pranayam, or any other type of non-pharmacological mental exercises that are advised, proper exercise, avoiding putting on weight, that is extremely important, or losing weight if somebody is obese, avoiding smoking. If you have diabetes and blood pressure, make sure that you take the right diet to control that. There is no specific diet as such for
Okay,
psoriasis,
sir.
but a proper balanced diet, plenty of antioxidants, leafy vegetables, etc., that is helpful.
So it's not just the doctor's job to keep the psoriasis in control. The patient also has to take care of the
Absolutely.
lifestyle.
See, in any chronic disease which lasts for years and years, patient has to understand the course of the disease and then avoid those kind of factors which are likely to trigger this. So, patient participation is extremely important in any chronic disease, particularly in a visible disease like psoriasis. Psoriasis is a problem because it is visible.
Yes, sir.
If it is invisible, people would not bother about it.
Yes, sir. Sir, so we were talking about psoriasis affecting other organs, but I want to know, does it spread to from one person to another, whether from within one family, like from a mother to a child? That is what people are most worried about. So, what is your take on that, sir?
It doesn't spread from person to person, it is not contagious. But this is question is important because everybody who comes initially to us, they are filled with two, three questions. One is this question: will it spread? Will it spread to my wife? Will it spread to my child? If somebody has got psoriasis on the hand, and if that mother has to feed the child,
Right, sir.
will it go to the child?
Yes, sir.
So these questions are extremely important. So we should emphasize this once again. It is not a contagious disease. It does not spread from person to person. There should be no doubt at all on this issue. The second thing they are worried is it curable, which we have already answered before.
Yes, sir. We have taken that up.
So, it is not contagious, it is eminently treatable. So, these two things, the message has to go out very clear.
So what are the treatment options that are being available these days?
See, treatment options, I want to say that the kind of options which are available for psoriasis, probably it is not there for any other disease. There are so many options for this. There are simple creams which can be applied for limited psoriasis, a little bit here, little bit here. Creams are enough. Likewise, shampoos, moisturizers, these are the first level basic treatments for limited area involvement.
Okay, sir.
Then there are devices, machines, phototherapy. You can see the photograph here. Phototherapy machines for whole body. Patient takes off the clothes and gets inside the machine. Narrowband UV, specific 311 nanometer wavelength, very safe, very effective, so safe that it is one of the few treatments which can be given in pregnancy.
Yes, sir.
No other treatment can be given in pregnancy, but this can be given in pregnancy. If somebody has it only on the hands and feet, there is a separate machine for it. You can see it here. Somebody has on the scalp, there is a different type of machine. Somebody has a localized area, targeted phototherapy. All these things are available, as you can see in this, and these are all available in Venkat Centre. But this is repeated visits to the clinic. Patient has to come twice a week or thrice a week, and in a city like Bangalore, where traveling can take 1.5 hours, this is very difficult for patients.
Yes.
Unless they are staying close to the clinic. That is a disadvantage. So that is about devices. Then you have tablets, different types of tablets. These affect the immunity, these affect the multiplication of cells. So there are several types of tablets that are available. Vitamin A derivatives, that's one type of
Okay, sir.
medicine that is available. Likewise, there is another drug called apremilast which is available. Recently, there are drugs which are called JAK inhibitors which are available for this. So these are all the oral drugs available. Then there are injections which are available, wherein you take one injection once in 2 weeks, sometimes once in a month. There are injections which can be taken once in 3 months. These are called biologics. So these are the different treatments available. So every case of psoriasis can be treated effectively.
So now we have these injectables, injections also.
Yes.
Okay, good, sir. And sir, what happens if it is not treated early? Like you said, we can apply creams when it is on the on localized areas, on even scalp also we can use shampoos. But someone ignores it completely, does not get themselves treated. So what happens then?
See, this question is a very important question because now there is evidence that if you don't treat psoriasis for a long time, particularly when it is very recurrent and when it is over larger parts of the body, or when it is certain special areas such as the scalp, the palm, soles, etc., that is a marker for developing other systemic problems such as blood pressure, metabolic syndrome,
Yes,
etc. Because in psoriasis, the T cells are acting, they are releasing several chemicals, cytokines, which can have an effect on the blood vessels.
yes,
So if you treat psoriasis properly, then that effect, long-term effect on those blood vessels is less. That means we are treating more serious disease and be able to prevent it. This is one of the newer developments in the last 10 years which has come. So psoriasis now has to be treated early and strongly and properly. So psoriasis should not be neglected. So once you treat psoriasis effectively and control the disease process and then maintain it, you will not only have a skin free of psoriasis, you are also going to have a comfortable life free from, or at least preventing some of those serious diseases.
sir.
So
Even
psoriasis has to be treated properly.
yes, sir. Sir, even joint involvement also
Yes.
is prevented by
This
that.
is particularly important for areas. For example, let us say that a young person, 24 years, still a student or just passed and has psoriasis of the scalp.
Yes, sir.
Now, if that person develops psoriasis of the joint, and if he is a computer operator, or if he is a surgeon,
Yes,
or if he is doing anything with his hands,
yes, sir.
then that life will be affected.
The total manual dexterity will
Yes.
be lost, sir.
So, that is why the psoriasis has to be treated properly.
And sir, you were talking about these injections. You are talking about these tablets. Sir, do they treat this joint disease also?
There are drugs which can treat the joint disease and quite effectively. There are many diseases which can, for example, methotrexate, cyclosporin, uh, JAK inhibitors, and then we have these newer biologics.
Yes,
They
sir.
all treat uh, joint disease also. And then sometimes in psoriasis, there is what is called enthesitis, where there is skin tenderness. That is,
Yes,
the
sir.
tissue becomes tender. When you press like this, they become painful. So joint may be normal, but they will have this. They all need these kind of treatments.
Okay, sir. And sir, this is all about what we can do from our side. Now, you mentioned that there are certain external factors which affect, some internal factors which affect. So, what can the patient do on their part to take a good control of their psoriasis?
There are two things that I want to say here. One is the patient has to be first aware of the disease, get informed and educated of the disease, and accept the disease. People generally have difficulty in accepting a chronic disease, particularly when they are young. So
Right.
that acceptance of the disease, that I have got this disease now, while it is going to come again, it is not a serious disease and I can handle it well if I treat it properly. This acceptance has to come first. For some reason, for skin diseases, this acceptance takes a lot of time because they look at it every day and that's a reminder. If somebody has diabetes, whether the sugar is 120 or 220, they will not know.
Yes, sir.
So there is no reminder there unless they go to a lab and do the test.
Yes, sir.
Here, every day there is a reminder.
Yes, sir.
That causes stress. So accept it. The second is then treat it properly by going to a dermatologist. People try all kinds of things, what is on the net, what is with some doctors,
Yes, sir.
various other systems of medicine. But please understand, with any kind of system, there is no such thing as a cure with one shot treatment. So go to the qualified dermatologist who will treat you properly. And third thing is, psoriasis itself can cause stress. So if you accept that, that part of the stress is taken care. In addition, you take care of other stresses, have a proper lifestyle, exercise, don't put on weight, a balanced diet, avoiding smoking, and then ensure proper sleep, ensure work-life balance. These are all important. And one sincere advice, take insurance early. That is extremely important. Otherwise, what happens is that pre-existing disease makes insurance difficult if you take it later.
Sir, even psoriasis falls under this purview of insurance.
See, psoriasis itself, insurance is not that easy for OPD treatments. That still has not come. Hopefully, someday it will come. But I'm talking of psoriatic enthesitis, psoriatic joint pain. If there is no insurance, invariably they need those biologics. And those biologics are expensive.
Yes.
Over a period of 1 year, it might cost 2 lakh rupees or 3 lakh rupees. So, insurance is possible for arthritis. But for that, you should have the insurance. Don't wait for arthritis to develop to get insurance.
Insurance.
Take it when this is. Let them document psoriasis. That is not the issue. But so you will get it for arthritis. So make sure that you have the insurance. So this is extremely important because hereafter, any medicines which will come will be of the biologic type and they will be expensive. Methotrexate is very cheap. But methotrexate is not going to be the future treatment. It is not going to be a disease modifier. You can keep taking it. But the biologics, which are the standard treatments, they will need insurance because they are all expensive. And they are also more comfortable. For example, now there are biologics which you can take once in 3 months.
Right.
Ustekinumab is there
Yes,
once in 3 months and that costs about 20,000 now. That means about 6,000 rupees per month. And when you look at the cost of phototherapy, cost of cyclosporin,
Yes, sir.
even cost of creams,
Yes, sir.
it almost comes to 3,000-4,000. So you just take one injection, you are free from disease. So that is the way to look at it.
And probably a better disease control.
Better disease control and prevention of other factors later.
Yes. Sir, another thing. So what is your take on steroids in psoriasis? Because steroids is the most common thing that either other doctors prescribe or sometimes the patients will ask for it.
For limited psoriasis, 1 lesion, 2 lesion, 3 lesion, steroid is a standard treatment which every one of us will prescribe.
But that too in topical, sir.
It's a topical therapy.
Yes.
We are not talking of oral drugs.
Yes, sir.
Topical steroids are a standard treatment for localized disease. There also it should not be used for a long time. There are other drugs which can be used. But oral steroids have very little place in management of psoriasis now. There were some types of psoriasis for which oral steroids were used. Even there it is not being used much now. So oral steroids have no place in the management of psoriasis.
Rather, it can cause flares, and that is why it is probably more important to go to certified and updated dermatologists than go to other.
Absolutely.
Yes.
Psoriasis cannot, the steroids can not only cause a flare, it can cause more complex types of psoriasis called pustular psoriasis.
Yes.
And that happens when somebody keeps taking psoriasis and steroids. And remember one thing, usually the dermatologists don't give steroids.
Yes, sir.
It is others who give steroids for psoriasis.
And we have to treat the complications
Correct.
then, sir. So basically it's a cooperation between the patient and the treating dermatologist which will ultimately give an optimum care for the psoriatic people.
Absolutely. And as far as possible, patients should stick to the same doctor. Usually what happens is that in the early part they are very frustrated, they are searching for a magic cure. So they keep going from place to place. That's a natural phenomenon.
Right,
but after some time, they should kind of okay, now I have seen everything, this is the situation, let me accept it, and then stick on to one doctor of their choice. That is very important so that he follows it and then so that he can give different treatments. No treatment works forever.
Yes.
There is always what is called rotational therapy. You have to
Yes,
keep rotating from one to another. And that is possible if you have one, for example, diabetes, blood pressure. They
Yes.
have one doctor for life.
Yes.
Same thing has to happen here.
That I think should be harped upon, that you should stick to your doctor
Yes.
and let him choose the medications for you that are going to be specific and going to be of good use. So thank you, sir, for your wonderful insights on psoriasis. I'm sure our patients would definitely be benefited from this, and we will also develop a system of care that will give optimum care, that will improve the lives of these people living with psoriasis.
One final message, please understand the disease, accept the disease, and take treatment properly, regularly, consistently, persistently. And then at Venkat Centre, we have all the options that are available for psoriasis, from topical drugs to oral drugs to machines and to biologics. And most importantly, we have a number of dermatologists, not one person. Now, psoriasis is not a disease which can be handled in a very quick 2 minutes, 5 minutes consultation. Particularly when we are giving drugs for such as injections, biologics, it needs extensive consultation. And then we also have facilities to keep them and observe. We have admission facility. We have a laboratory where we can do all the tests. And more importantly, we have young doctors who will follow it up, and then we discuss the cases. In long-standing psoriasis, such management is extremely important. And where necessary, we have links with rheumatologists for joint disease, cardiologist where it has to be for heart disease. Such facilities are available. So please remember this and visit our website for further details. If you have liked this video, please share it and please give us your feedback. Thank you very much.
Thank you.